Welcome back to Navigating Cancer. I'm Dr. Joey Bennett with Wendy Hall, and today we're talking about prostate cancer. Wendy's been on the phone with her husband. We're getting him in for his, he doesn't know it yet.
He's good at, no, he's good about it. He is one of the rare males that is good about his tests.
I mean, it's, you know, one of the things we were discussing earlier is it's very hard sometimes to get people to go out and get screened for these things, but when you look at mammography, when you look at the PSA blood test for prostate.
We don't like mammographies either.
I know, yes. But, you know, in your pelvic examinations for your pap smears and your colonoscopies, none of these things are fun, but they clearly have been proven to find cancers earlier, to allow us to treat cancers better, and it's the secret to it. And it's the reason why we have more and more people living every day in this country who are alive and well and cured of their cancer because of early detection and treatment. One of the things that we want to get into in this segment is that we want to talk a little bit about the treatment of prostate cancer. There are basically only two methods of treating prostate cancer. One is surgery and the other one is radiation therapy. A lot of people will tell you that they have heard about cryotherapy, which is freezing the prostate, and they've heard about HIFU, which is a microwave type therapy which treats the prostate. But those are not really good treatment options because they do not provide you with as good of a chance of being cured of your cancer as the radiation therapy and the surgery will. And a couple of very important studies just came out looking at prostate cancer and how it's treated. And the first one I want to talk to you about is the surgical side of things. This is an article that came out recently in a publication called Oncology Times that we get. And it's talking about the surgical treatment of prostate cancer. Unfortunately, in this country, most people have moved towards a robotic prostatectomy. Many of you may have heard of the Da Vinci prostatectomy because it's the new shiny car in town with absolutely no proof that it's any better than the standard open radical prostatectomy to remove the prostate. And this is an extremely good study which was looking at this data, and I want to read to you a couple of things here. They found that the complications with the robotic are no less than with the open procedure, and there are now 4 published studies aside from this one that have shown that the complication rate actually can be higher with the robotic, and what's very disturbing is that the cure rate is lower with the robotic. So why in the world would you want to sit here and go and have a procedure done with a higher complication rate and a lower cure rate just because it's a robot? It makes no sense at all, and I encourage everyone who has prostate cancer to think twice about a robotic procedure. And the other thing is skill. If you're not doing hundreds of these a year, you're not going to be skilled at it like someone who is. So the robotic procedure for a prostatectomy, in my opinion, is uncalled for. And what they found here is that people who had the standard procedure had less incontinence or urinary leakage. They had fewer problems with sexual function and erections afterwards. So it's an absolutely wonderful study showing that even though the robot is the brand new thing in town, it's not necessarily the way that we should be treating prostate cancer. And so if any of you out there have been diagnosed and you're looking at potentially doing a robotic procedure, go and get a second opinion about that. Think long and hard because it's not worth...
I think they just had one.
Well, yeah. It's not worth getting out of the hospital one day sooner if your cure rate is lower and overall your complication rate is no better. And so I think that, you know, this is very good evidence from Ohio State University, even though I have trouble saying that. That this is not the way that you should be treating prostate cancer. From a standpoint of surgery versus radiation, I generally tell people that if you get an open prostatectomy or if you undergo radiation therapy, the cure rates for the disease are really the same. The chance of being cured and living your normal life expectancy are the same. So the decision between surgery or radiation really is a personal one. And what we have seen over the past decade is a shift to where more and more men are leaning towards the radiation instead of the surgery because your quality of life after surgery with the radiation is better. It just simply is better because there's a much lower risk, if any risk at all, of incontinence or leaking urine. You can still be sexually active. You can be active all the way through your treatment. You never have to miss a day of work or a day on the golf course or a day out in the Gulf fishing. You can do anything you want to do. So many, many men, as a matter of fact, the majority of people now in this country are treating their prostate cancer with radiation. And from a radiation standpoint, we too have this new toy in town, and it's not really new. Proton beam therapy has been around for decades, but up until about the last 15 years or so, there were only a couple of units in this country. It cost about $150 million to build a proton facility for treating cancer, and the only thing proton beam therapy has ever been shown to be beneficial for are brain tumors and pediatric tumors. Well, there aren't that many of those in this country, and so if you're relying on those two cancers to cover the cost of a $150 million facility, it becomes very hard. So what's now happened is that some of these proton beam facilities are trying to treat more and more prostate cancer. It costs 5 times more money to treat with proton than it does with photon, which is what we use at our facility, and the results are absolutely no better, and as a matter of fact, based upon a new publication, they may be inferior. So we may be looking at a treatment that costs 5 times more than what can be done right here in Citrus County at our facility, and having a lower chance of cure and a higher risk of complications. And one of the great quotes here is from Dr. Anthony Zeitman. He's at Harvard Medical School, and he says he's not surprised at all because when new technology is introduced, we tend to just jump right on them. Same thing with the robot that we were talking about earlier, and all of a sudden we finally start getting data in. So these are both very good examples, I think, of the fact that when you look at a cancer treatment, we need to look at the big picture of what's my quality of life going to be like after I'm done. Every study that's ever been done comparing radiation with surgery shows that men who have the radiation are more satisfied than those who have the surgery. We don't need to be doing surgery with robots when the data doesn't support it at all and actually says that it's probably inferior to the old-fashioned way of touching it. Dr. Mark Fernandez, who was on our show one time, said that there is nothing that can substitute for his ability to feel a tumor as he is taking it out, and you can't get that sensation with a robot. And the other thing is we've got to look at the cost of treatment. If you've got 2 treatments that are equal to each other and one costs 5 times more, we cannot afford to continue to waste our dollars that way. So hopefully we've enlightened you a little bit today about prostate cancer. Hopefully we've given you a good idea about your different options that you have for treatment, that you do have decisions. Don't ever fail to ask for a second opinion about anything at all, because if someone doesn't want you getting a second opinion, they're probably not telling you all the truth in the first place.
And they can come to your meetings and they get all this kind of updated.
Our Prostate Cancer Support Group meeting is the first Wednesday of every month at our office. We hope to see you on the next episode.